Hello, I'm Jawad and I'm the Executive Medical Director at East Lancs. This is my update on the week beginning 3rd of October 2022. You probably are seeing a bit of a different background and setup to what I have been previously doing as my updates. And colleagues will recall that my last update, I went to Discharge Lounge where you met a couple of colleagues and they gave you an update on what happens in that place. So I am today in AMUB. Now, before I can bring in my colleagues who will update the fantastic work that goes on in this unit, very briefly, just to tell you of what's happening locally and regionally. As you can probably see, I'm wearing a mask now, and the reason for that is the increasing number of admissions to hospital with COVID patients. In keeping with COVID, we have started with the booster vaccination, and a number of colleagues have had their booster. Again, we are requesting everybody who is a healthcare worker to get the vaccination. This will help protect them and their loved ones, but most importantly, the patients who we all are here to care for. Without further ado, I'll move on and introduce you to Vicky and Jayne. They work on AMUB. I'll let them introduce of what their roles are, and then they'll be able to talk through of what type of patients they look after, what sort of work they do, and in fairness, what sort of a day in a so-called normal week they face. So on to you, Vicky and Jayne.
Yeah, hi, I'm Vicky. I'm the matron for acute medicine, AMU fast floor anesthetic. This is Jayne. She's a clinical lead nurse, quite a new role to AMU, but we'll speak about that later. And we work daily on AMU. AMU is set up with two different units. We have AMU A and we have AMU B. AMU B, out of the 73 beds, has 10 higher observation beds, which we all have cardiac monitors on, the nurse by our clinical lead nurses. Our patients vary from 16 to any age, 100, if 100 plus. We get every medical illness you can think of, heart problems, strokes, you name it, we get it. And our main aim is to take from ED, then stabilise and try and determine the diagnosis of the patient and move them to the correct speciality so that they can get further assistance by the relevant medical team. We also discharge from here straight back into the community. We use discharge lounge, we use IHSS, anything. We do tend to discharge 55% of the patients straight from AMU. And I'll hand over to Jayne, and she'll tell you about all the different roles that we have on AMU.
Hi, my name's Jayne. I'm one of the clinical lead nurses on AMU. We have numerous roles on AMU, from nurses to senior nurses, HCAs, ward clerks, housekeepers, who are all a part of our team. My role is to work in the high observation beds, which is a 10-bedded area with cardiac monitoring, and we go down to resource A&E and look for cooler patients that are suitable to come to our high observation beds. We do have challenges which we can't fulfil and get them in straight away, but we do try and overcome that by looking at moving them out of there that don't need the higher observation bed and trying to get the resource patients in.
Thank you. Thanks, Vicky and Jayne. It's great to hear the work that goes on in this place, and goes without saying that it's a team. It's just not about doctors or nurses. It's about every individual in the organization who looks after the patient, right from the word the patient walks into A&E to the time they are discharged. And again, it's important what you have said of your role, where you are pulling patients from A&E who are not well and helping stabilize them, and then If need be, they move on to other wards, and if need be, they are discharged home through the discharge lounge or directly from here. So it's a great piece of work, colleagues, as you have heard from Vicky and Jayne, that goes on in AMU. As we say in words, it's a very high turnover unit, which means that the patients are rapidly coming in, but also getting the appropriate treatment, are being discharged in a timely way. It's a workhorse of the organization, if I may say so, on the medical side, AMU. And a big thanks from all of us to colleagues who work here. So thank you again, and we'll see you next time. Bye for now.